Hello, everyone, and welcome to CancerSpeak, the official podcast of Cancer, a journal of the American Cancer Society. I'm Dr. Camille Ragin, and I'm your host for today's episode. I serve as the section editor of Disparities research for cancer, and I'm so honored today to be joined by Dr. Lauren McCullough, who is one of the principal investigators of the Voices of Black Women study. And this is a landmark initiative led by the American Cancer Society, and it's aimed at deepening our understanding of cancer and other health conditions affecting Black women. Dr. McCullough is also the lead author of an editorial which is available in Cancer. And this editorial outlines the rationale behind launching the Voices study, and it also shares some early insights that have helped to shape its design and also implementation. Dr. McCullough, welcome to CancerSpeak, and thank you for joining us today.
My name is Lauren McCullough. I am a visiting scientific director at the American Cancer Society, co-principal investigator of the Voices of Black Women. I also have an appointment as an associate professor in the epidemiology department at Emory University. I'm a cancer epidemiologist by training. I've been studying cancer for the past 20 years, and for the past 12 years, that research has been exclusively focused on Black women. I got into this because of my personal experiences with cancer. My dad passed when I was a sophomore in college of cancer, and since then, 3 of his siblings have been diagnosed with cancer. And so it's something that is very personal to me and personally impacts my community. So I am very compelled to do what I can to end cancer as we know it for everyone.
So let's get into it. Can you share with us a quick summary of your editorial and give us a little bit more background or information about the Voices of Black Women study, especially for those listeners who are not familiar?
Absolutely. So we wrote this editorial with the intention of having the public, so the scientific community and lay communities, really understand the rationale behind developing this study, as well as the work that went into thinking about its design and implementation. And so in the editorial, we really give a fair amount of background on cancer statistics, particularly among Black women, which has really defined some of the research goals of the past and priorities. But also, it has left some gaps that have not yet been filled and knowledge that we do not yet know. And a lot of that has been the motivation behind developing Voices. So we also talk a little bit about our process in developing a cohort. I don't know how many people have developed cohorts in their lifetime, but it is not an easy task. So many decision points. I was totally at decision fatigue between 2022 and 2023, but it certainly is a process. And so we outlined some of the formative work that we did with focus groups and just talking to Black women, both with and without cancer, the challenges and barriers to research participation, developing a scientific advisory board and making sure that board is representative of the community and has worked with the community, as well as just getting community response to everything from the colors to the images to the consent form, and how all of that really led into our final decisions about how Voices would look and feel for the public. Of course, we talk through what's required for participation in this study. Our eligibility criteria being a Black woman between ages of 25 and 55 residing in any of the 50 states or DC. And we talk a little bit about their engagement with the research team through questionnaires and other touch points. And then finally, we close the editorial just by talking about what we see as being the potential outcomes, both scientific and policy outcomes, and really improving our knowledge around Black women's health, cancer health, while also engaging minority scientists who can lead this work in the future.
That's fantastic. I want to touch a little bit on the focus groups because you mentioned that was very important in helping with design. Can you tell me a little bit more about what did you really learn from those focus groups during the pilot phase, and how did it really help to shape the design of the study?
Absolutely. So the first focus group was very early on, and largely women were from the southeastern United States. And again, both with and without a cancer diagnosis. And what we were really interested in understanding were 2 things. One, barriers to research participation. I think as a scientist, we all kind of know about the historical contexts which shape how people feel about research, including Tuskegee and Henrietta Lacks and other things. But there are more barriers than than just those. And so really trying to understand what women consider and think about when choosing to engage with us in research. And some of the insights we got from that is barriers also include their feelings about the organization or the institution that's performing the work. Has this been an institution that has historically engaged with community? How have they engaged? How have they built trust? Having research leadership look like the participants. Not only does it help with trust, it also allows for some of the nuances around the study design and how the data are disseminated back to communities, allows that to be a little bit more streamlined. And so a lot of women recognize that as being something that may facilitate or hinder their participation in research. And women talk a lot about logistical barriers. So one big one being time. I don't have time to do this, right? I have dependent care. I have elder care. I don't want to pay for parking. And so how can we reduce the logistical barriers and make it easy for people to want to engage with us in research? And then some of the technical barriers, as you know, technology is exploding and some are on top of it and some are not. And a lot of participants could feel a little bit hesitant to engage based off of how much technology is involved, how much of their personal information is going to be held in technology and who's guarding that and securing safeguards around participant data. So those were some of the big barriers. But what we also learned were what are some of the opportunities? And some of those you can guess based on the barriers, like inclusivity of the research team and scientific leadership, making sure that we optimize things for not just computer use, but also mobile use. People feel a little bit more comfortable navigating a phone than they do a laptop or tablet oftentimes. And really just that women just want to feel a part of the process, not to come into communities and do research on the community, but do research with the community. So those early insights were really what led us into our guiding principles for designing Voices.
Yeah, that's awesome. It really sounds like Voices not only increases representation in the data, but it also increases representation in the research process, right? And clearly from the focus group, you were able to really help to improve those two aspects. Let me ask you this. How did the participation of Black female researchers shape the study and influence its impact?
Absolutely. So if you go to our website, voices.cancer.org and go to research team, you can see the women that are behind this study, and 80% of our scientific leadership are Black women. And I'll just start by saying it's such an honor to be on a team that looked like me and like the participants. I had never had that experience as a scientist in my 20-year career to have so many women representing this particular demographic. But I think by having that representation, we were challenged and we wanted that challenge. Everything from do we give incentives to how much time are we asking for to even the colors. American Cancer Society is known for its red, white, and blue. Well, that wasn't sitting with our SAB, our scientific advisory board. And so at every step, I think because these women are a part of these communities, they see themselves, their families, their friends in this community. And so there was just this higher level of accountability. And with that came the tough questions and the tough decisions. And so I think it just made everybody rise up to a different level, having that representation in the science.
That's fantastic. So let's dig in a little bit deeper. So we know that large-scale cohort studies have shaped our understanding of cancer risk, right? But we also know that Black women have been actually quite underrepresented in many of these studies. What are some of the biggest gaps in our knowledge that Voices is really designed to fill?
Absolutely. The past few decades, I think we have done a lot to narrow some of the gaps. Even the most recent facts and figures for African Americans acknowledge that we've seen improvement in this demographic for cancer, but we still have some robust disparities. Black women are about 9% less likely to be diagnosed with cancer, but 10% more likely to die from it. And in particular, breast and uterine cancers are two that stand out as having pretty robust disparities. And so I think in the past 2 decades, we've learned a lot around social determinants of health, thinking about healthcare access and transportation and health insurance as being pathways to achieve optimal outcomes in cancer. But some of the things that I think are really only emerging are thinking about sort of those upstream drivers, like the structural barriers that women experience day in and day out. And so not just thinking about, how does my neighborhood's transportation and impact my ability to get quality care, but thinking about, well, how have the decisions been made, whether or not to have transportation in these neighborhoods? And how does that lack of transportation also translate to my ability to access healthy foods, healthy activities, etc.? And so it really, I think, highlights and showcases that you can't compartmentalize one social determinant from another, that these things are all operating together. And so because of this new and emerging interest, when we look to the current cohorts, they really lack data in thinking about some of these things and how the structures and environments that women live in impact their daily decision making and their daily habits. And so what we're hoping to be able to do is to shed some light on that. How does structural racism impact you? How does discrimination impact you? How does generational wealth impact you? Because I can be a Black woman with $100,000 salary, but if I'm supporting my elders, my family, my fifth of kin, then that money dwindles down pretty quickly, right? And you can understand how there may be a financial toxicity for that woman, whereas it may not be for her white counterpart who has generational wealth and support. And so really digging into some of those things, I think, is important as we conceive interventions in this community. The other thing that I'm really excited to dig in on is this idea of diminishing returns, that even for Black women who have access to care, who have insurance, who have transportation, who live in more economically affluent neighborhoods, that's where we see some of the biggest disparity. And it counters our intuition that you get access to these things, you should presumably be performing pretty equally to your white counterpart. And we just don't see that in the data. And so that suggests that other things are happening. There are things that we haven't measured, we haven't considered. And those are the things that we're asking about and want to highlight in Voices.
Yes, you really do touch on a very important point here about the different types of determinants that Voices really is capturing beyond the usual established health determinants, as you've mentioned. There are some of these determinants include novel areas of emerging research, like the personal care product use, racism, discrimination, and you mentioned generational wealth. And you did touch on this, but I just would love for you to expand a little bit more on why do you really think it's so important to include these other factors that really have not been evaluated well in other studies? And how might this really shape what we know about cancer risk and outcomes for Black women?
These other factors, I think, are important because they, alongside some of the factors that we know are established, may modify, may mediate some of the associations that we know. And so what that means for our lay community is that, yes, I know it's important to exercise. Absolutely. But once you layer on neighborhood environment on top of that, yes, it's important to exercise, but in what context? Should I go outside in my neighborhood that is highly polluted and exercise? Or should I be going elsewhere because my neighborhood doesn't provide an environment that is going to be beneficial for me? Those are the kind of nuanced things that we really don't know and don't understand and can't speak for this particular community. And so it's important to be able to align things next to each other. And that's where we begin to see nuance, right? It's not a one size fits all. It's very nuanced. And we know that people have different experiences, have different environments, and even Black women are not a monolith. Like there's a wide degree of heterogeneity in this population. And as we begin to have the numbers to look at some of these nuances, that's when we begin to have more tailored public health messaging. And that's going to be really important for cancer prevention and risk reduction.
Absolutely. I think that's really a very powerful approach in the way that this study is designed in terms of the data that's being captured. How do you see voices influencing cancer prevention strategies? Because, I think that's another important piece that we really want to make sure that the information that you're gathering translates into these prevention strategies and approaches. Where do you see those benefits?
Right. So I certainly see them in more tailored messaging around what is optimal for cancer risk reduction. One really good example is we know that obesity is linked to 13 different cancers, but we know that the way most studies have looked at adiposity is through body mass index, which is not a good measure, particularly in this population. And so being able to be more precise in what do we mean by being overweight? Is it where you carry your fat? Is it the exact number, at 25, you're magically overweight, and at 30, you're magically obese? Is it some combination of being at a healthy weight for you plus a certain diet? These things are going to be really important if we're speaking to our cancer prevention messages. And then also thinking about all the things that are important for related to cancer screening and early detection. We know that Black women, for example, for breast cancer are screened pretty equally to their white counterparts, yet are being diagnosed with more aggressive disease and at later stages. And so what else do we need to be telling Black women to do to receive those outcomes that are more optimal? It's not just get screened, because they're doing that. What else is there? And so we're hoping that by having this very granular data, we can add to the messages that are existing that are important for this group.
What do you feel needs to happen to make sure that the findings really lead to real change?
That's the money question. That's why I'm here. Science for sake of science, it does no one any good. I love publishing in great journals like Cancer, but if it doesn't get to people, why are we doing it? And I think that is one of the amazing opportunities about doing this study in the context of the American Cancer Society, because we have those sister pillars that are able to translate to advocacy and be on Capitol Hill to fight for the things that are needed. We have colleagues and patient support who then know, what is this demographic need? How can we take the needs of the community and implement them into our normal workflow to ensure that everyone has equitable access? Having this study within the context of the ACS, I think, really helps us with translation. But one of the other things we also need to think about is, how do we provide this information back to communities? Because it's not just top down, it's also bottom up, and ensuring that the communities are equipped with the knowledge to be able to create change within their own spectrum of control. And so really trying to improve our relationships with community organizations at a local and regional level is something that the team has really been thinking about to ensure that translation and ensure that we have those outcomes we're looking for.
Absolutely. You mentioned that this obviously is a cohort study, so you are following women over time. What are some of the strategies that you have in place to really ensure that the study participants are going to stay engaged over time?
That is always a good question for epidemiologists. We talk to women and want them to be involved, and they say, well, how long? We're like, that's long term, and that can mean decades. And it needs to be decades, because all the time that you spend leading up to a cancer diagnosis is important, and we want to get information across time as exposures change. And so what we have really tried to do from the outset is to ensure that women know that this is a partnership. I, as a scientist, cannot do what I am trained to do, and that is to analyze data and communicate the scientific outcomes if you as a participant aren't willing to share that information with me, right? And we need each other. And so we have tried to communicate that need to our current participants. And even more than that, try to facilitate a community among our Voices participants, so that you realize you're not just doing it for you and your community and your children, but also for your sister girlfriend who also joined the study, who may be in a completely different state, and that we all need each other. Every community has to be represented for this to work and for this to be informative. And so really trying to communicate that sentiment that we're in this together, I think from the beginning has been really helpful, but also ensuring that we're giving something back to participants. It may not be monetary, because there aren't incentives for enrolling in the study. There are for some of the other enhanced features of the study, but these women get to engage with us as scientists, sharing the data, sharing new things that are happening in science more broadly, what they're hearing in the media. We may have a webinar to talk about those things. So they're getting scientific knowledge, they're getting tips on health. And of course, if there's a cancer diagnosis, then we certainly try and make sure that these women understand and know the resources that are available to them through the American Cancer Society. So really just creating our own little Voices community. We hope that women want to stay engaged with us for the long term.
That's wonderful. Is there anything else you'd like to share about the study?
Other than the fact that it is such an honor to work on this study, and I am so grateful for every participant that has joined the study. Even today, we were looking at some of the data on the personal care products, and upward of 90% of women had a relaxer. And that number is staggering given what we know in the emerging data in that space. And so it's exciting as a scientist to be a part of this community. And I just want women to know that when you join this community, when you become a Voices participant, we hope that you feel seen, and we hope that that you feel heard, and that the things that are important to you are a priority to us. And so we really value this bi-directional communication of our participants sharing what's important to them, what's happening in their local neighborhoods, and us as scientists having the challenge of figuring out how to address it. So we're still looking for women to enroll. 100,000 women is a big number. I know we can get there, but it's only with participation of folks who feel compelled to join.
Thank you so much, Dr. McCullough. Thank you very much for taking the time to join with me today. Before we wrap up, though, could you share where our listeners can learn more about the Voices of Black Women study? We'll be sure to include the links to any of the resources in the show notes.
Absolutely. So if you're interested, you can go to voices.cancer.org. And from there, you can check your eligibility. Black woman between the ages of 25 and 55, not have been diagnosed with cancer except for certain skin cancer, living in any one of the 50 states or DC. You would complete a short consent for us because we want you to know what the study process entails. Register for the study, which takes about 10 minutes, and then you get your first questionnaire, which is about an hour. And thereafter, you would just be completing 2 short 30-minute surveys per year. So it's an hour investment, just an hour per year for us to really glean new insights.
This is really valuable information. Unfortunately, this is all the time we have for today's episode. But Dr. McCullough, I truly appreciate you being here and sharing your expertise. And also a special thank you to our listeners for tuning in. I encourage you all to read Dr. McCullough's editorial, The American Cancer Society Launches the Voices of Black Women, a longitudinal population cohort study, and it's now published in Cancer. You'll find a link in the show notes. And if you know someone who may qualify for the Voices of Black Women study, please check it out. Check out the link that will be provided in the show notes for more information.